Metastatic breast cancer is very concerning for a lot of individuals because people think that if I am diagnosed with metastatic breast cancer, I will die today. And people have been living longer with breast cancer. Can you tell me more about what metastatic breast cancer is and a little bit more about the course of the disease and how it's treated?
So I think what you mentioned at the beginning is extremely important. There can be a lot of confusion about terminology. So I'm going to just repeat some of what you said. Metastatic breast cancer can also be called advanced breast cancer. It can also be called stage 4 breast cancer. And essentially what it means is that some of the original breast cancer cells have moved away from the breast and have spread to different parts of the body, and they have started to grow there. And as they grow, a patient can develop symptoms, for example, pain or shortness of breath, and those changes will ultimately become visible on scans. And for breast cancer, there are certain patterns of spread. Breast cancer is commonly found in the liver when it has spread, or in the lung, or in these lymph glands that are around the body. It commonly goes to bone, where patients can actually present with bone pain or fractures, and it may also spread to the brain. Sometimes patients have had a history of breast cancer in the past, maybe 2 months before, 2 years before, 5 years, 10 years before. And then there's a clear pattern that it was present in the past and now has resurfaced. Other times, the patient never had a diagnosis in the past and they are presenting for the first time with stage 4 breast cancer. The good news is that we have lots of different treatments to offer to patients with metastatic breast cancer. And although we are not really considering cure in these circumstances, we can offer many treatments to keep the cancer in check for oftentimes a very long time.